Welcome back guys, to another interesting video. This video is little informative one. And it's about an infective virus spreading and killing people in our country. So let's explore it. Nipah virus infection, NIV. So, what is Nipah virus infection? Nipah virus, NIV, infection is a newly emerging zoonosis that causes severe disease in both animals and humans. The natural host of the virus are fruit bats of the Pteropodidae family, Pteropus genus. NIV was first identified during an outbreak of disease that took place in Kampung Sungai Nipah, Malaysia in 1998. On this occasion, pigs were the intermediate hosts. However, in subsequent NIV outbreaks, there were no intermediate hosts. In Bangladesh in 2004, humans became infected with NIV as a result of consuming date palm sap that had been contaminated by infected fruit bats. Human-to-human transmission has also been documented, including in a hospital setting in India. NIV infection in humans has a range of clinical presentations, from asymptomatic infection to acute respiratory syndrome and fatal encephalitis. NIV is also capable of causing disease in pigs and other domestic animals. There is no vaccine for either humans or animals. The primary treatment for human cases is intensive supportive care. Who are the major carriers of the virus? Bats shed the virus in their excrement and secretions, but they are symptomless carriers. NIV is highly contagious among pigs and is spread by coughing. What are the symptoms of the infection? When a person is infected with the Nipah virus, they experience encephalitis, or inflammation of the brain. It typically takes 5 to 14 days for symptoms of an infection to start to appear. These symptoms include fever and headaches that are followed by drowsiness and confusion. It's then possible for the symptoms to progress to a coma. The CDC says long-term side effects among survivors can include convulsions and personality changes. How can it be prevented? As options for treatment are limited, the focus should be on prevention. Strategies include preventing farm animals from eating fruit contaminated by bats and avoiding consumption of contaminated date palm sap. Healthcare workers caring for patients should put in place standard precautions including washing hands. Wearing a gown, mask, cap, and gloves is also recommended. Please do share this video so that each and everyone can be safe from this virus. Make sure to subscribe this channel JP StuFFs for more interesting videos.